Okay, so the structure of most MD-PhD programs go by the 2-4-2 model. And that's where you do the preclinical years, the first 2 years of medical school, you take step one, and then you do your PhD, and then you do the second 2 years of medical school, apply for residency, or do whatever it is you plan on doing with your degree. Then some schools go by the 3-4-1 model instead, where you do the first 3 years of medical school, take step one and step two, and then do your PhD, and then finish up the last year. And most schools do that 2-4-2 model. I've only came across like 2 schools that did a 3-4-1. And then even the one that does let you do 3-4-1, they let you pick whether you want to do 3-4-1 or whether you want to do 2-4-2, like the traditional model of most MD-PhD programs. And besides that, the only thing that's really going to change in structure probably is when you do your like lab rotations for graduate school and when you do your clinical rotations for medical school, because that's when you have a lot of crossover and the timelines can get a little iffy between schools depending on what the policy is for your medical school. So for my medical school, we have 3 sets of clinical rotations that we have to complete. And just based off the timing for when you take your step one exam and when graduate school starts, you can finish up one of your clinical rotations before graduate school starts if you take your step one exam early enough. And that's what a lot of the students in my program did. Some of them either pick one of the ones that they're most interested in, or they pick the really hard one and get out the way. Like a lot of people do their like surgical clinical rotation before just to get out the way, or they pick the one that they know is like probably going to be their favorite one, and then they do that and then get it out the way before graduate school starts so they don't have to do it later. And some schools also are going to change in when you have to do your research rotations or your lab rotations. Most MD-PhD programs I know require you to do at least like 1 or 2 before you start graduate school. And usually most students do that in the summer in between MS1 and MS2 year. My school also lets you do a summer research rotation before you started MS1. And that's what I did this past summer. I did a rotation. So I only have to do 1 next summer instead of doing 2 back to back like some students might have to do. But you get to pick when you want to do them. And that might be different across schools, but that's the case that I know for most schools. And then in addition to that, some MD-PhD programs, you're going to have to take 1 additional class while you're in med school. And it's more so like a class to stay compliant with the NIH grant that you're awarded as an MD-PhD student. And it's a very low commitment class. We literally don't really do that much work, and it's only once a month, and there's only 6 sessions, and it's like ethical conduct of research. So we literally just discuss different ethical issues in research, and it's very low commitment, but that is an extra requirement that we have as MD-PhD students. And then your program might have individual things that they want you to do, like we have a retreat every summer, and then we have our own like little organizations that we each contribute to.